Okay, so this learning unit, the last learning unit was on understanding abnormal behavior with a breakdown of some of those mental disorders that we find are quite prevalent. So now we're going to look at the treatment of abnormal behaviors. So this is learning unit 5. When we look at our module outline, it's only got 3 learning outcomes here. The one is to be able to discuss the different treatments for abnormal psychology. And I've put a star there because I think the page numbering in your module outline is incorrect, but you'll figure that out yourself in the textbook. So it's actually pages 641 to 658. So we do that. We look at the role of different mental health professionals in dealing with abnormal behaviors, as well as making sure we understand what the difference is between a psychologist and a psychiatrist. So a nice little quote there that comes from our textbook is, as a multicultural society, we will only treat abnormal behavior effectively when we're mindful as to how the behavior is viewed from multiple perspectives. So that's especially true in South Africa with diverse cultures, is we can't always only look at things from one perspective. We have to look at it from different cultural and religious perspectives. So it's something always to bear in mind when we treat abnormal behaviors. So when we talk about abnormal behaviors and treatment thereof, we talk about the term psychotherapy, which is different to psychoanalysis. That's a type of treatment. But psychotherapy generally is all of those professional approaches that we use when we treat mental disorders and psychological problems, or when we treat abnormal behavior. So psychotherapy is our big term. When we look at it in this module and in this chapter, we don't really go into depth as to how to treat specific mental disorders. We rather look at the 3 sort of broad spectrum approaches to treating mental disorders or abnormal behavior. The one approach is called insight therapy, which is like a talk therapy, and we discuss Freud and the humanistic approach to doing that. Another way for treating abnormal behaviors is through actual behavior therapy, which deals with the fact that all abnormal behavior is learnt. And we also look at the process of psychopharmacology, which is the medical approach to treating, or the drug approach, or the electroconvulsive shock therapy approach to treating abnormal behaviors. It's also called a biomedical therapy because it comes from a biological perspective. So those are our 3 big treatment approaches that we sort of cover in this module, without going into too much detail about how each one is conducted, because there are multiple ways to conduct these particular kinds of treatments. But what is interesting is putting it into context of where we are in at the moment is basically the first big sort of cross-population study on mental disorders in South African population took place in 2014. So it was relatively recent. And what that study found is basically about 1/3 of South Africans suffer from some kind of mental disorder. So that's a large number of people. And what they also found is that the prevalence of mental disorders was predominantly anxiety, and that was found mainly in women. And in men, the predominant disorder was substance abuse. So those are quite interesting statistics to look at, that we're not always looking at things like schizophrenia or bipolar, but anxiety is a great cause of mental illness in this country, as well as substance abuse. But the sad thing is that of those who are suffering from mental disorders, about 75% of those don't have access to treatment. We have scarce resources in our hospitals that can't treat mental disorders. And think about it also during COVID, how those numbers escalated or worsened during COVID. So the current situation is probably worse than that cross-population study done in 2014. And there's also a very big stigma about people getting help for mental disorders. So there are numerous barriers. So we have this large number of people who suffer from disorders, but not significant numbers of them are treated due to the poor resources we have in our country, as well as to the barriers that people have around getting treatment for mental disorders. So it's something just to be aware of when we're talking about abnormal behavior and treatment in a contextual situation. So when we treat something, we're treating it from the psychological perspective. So when we treat something from any perspective, we really need to look at the etiology, which is the causation of mental disorders, in order for us to be able to treat them effectively. So generally, there's a treatment protocol, which is a specific way of treating and managing a disorder. And there's many that have been developed and implemented and evaluated over time. So it really involves the clinician, whose role is to identify, modify, and implement empirically supported treatment regimes. So however a treatment takes place, it has been something that has been researched and established and scientifically supported as a specific way of treating a disorder. And it's also important, when I said to you, we have to look at it from multiple perspectives. One of the ways we look at it, or probably the key way, is what's called a biopsychosocial perspective, which means however it's looked at, it is generally an interaction of factors that happens to cause a mental disorder, and therefore it also needs to be considered in the treating of a disorder. So those are the biological dimensions, the interpersonal dimensions, as well as the social dimensions of a particular disorder, and to consider those when we look at treatment protocols. So when we treat somebody with a psychological disorder, it might not necessarily be one person who's providing that treatment. There might be a range of people involved in the actual treatment of that particular disorder. And it can take place at the same time, whoever is consulting. So when a person presents with a problem, basically the role of the clinician, the person treating, is to really gather as much information as possible, including information around their biological background, their psychological background, their psychosocial functioning, which considers that biopsychosocial approach. And basically, the clinician provides some kind of diagnosis in order to provide a treatment, okay, which often uses certain diagnostic tools that have been developed. But there are multiple approaches to treatment of psychological disorders. So it's also important to bear that in mind. So as I said at the beginning, we look at three main groups here of types of therapy. We look at insight therapy, behavior therapy, and psychopharmacology. So the diagnosis part is really being able to understand the current medical condition, making use of diagnostic tools where necessary, such as standardized tests or psychometric tests, and make use of objective observations and subjective accounts to use diagnostic inquiry and to gather as much information as possible together in order to start a treatment process. So that's just a little bit of background. So when we talk about different people treating mental disorders that fall under mental health professionals, there are a number of people who play a role in that. So basically we have a psychologist who is somebody who's studied, done a degree, done their honors, done their masters, done their clinical training. Generally, when you have a psychologist, you either have a clinical psychologist or a counseling psychologist, but they're registered practitioners with the HPCSA. Okay, so that's the process of a psychologist. They treat mental disorders from this kind of therapeutic approach, either as a clinical psychologist or a counseling psychologist. They can use diagnostic tests. They can look at what's causing a disorder. They can look at a treatment for a disorder. A psychiatrist is very different to a psychologist in their training. So a psychiatrist is a trained medical doctor. They're someone who's done a degree, a Bachelor of Medicine and Surgery, and then they've got into specializing mental disorders. So because they are doctors, they can now dispense medication to treat disorders. So really that pharmacological intervention is where a psychiatrist comes in. But a psychiatrist and a psychologist often work hand in hand to treat somebody who's got a specific problematic mental disorder. So it's important from our learning outcomes that we just understand the difference between a psychologist and a psychiatrist. Very different courses of study. There's some overlap in their treatment approaches, but generally your psychiatrist is the person who dispenses and deals with the psychopharmacological component. A psychiatric nurse is a nurse who studied nursing, but again goes on to specialize in mental illness. And basically they work with patients who are already in the hospital. So a lot of your hospitals that specifically treat people with mental disorders are staffed by qualified psychiatric nurses. Your counselors are basically there to promote psychological well-being. It can be in many settings, and generally a counselor is a short-term supportive approach to treatment, who could then very well refer on to a clinical psychologist or a psychiatrist, but they work in multiple settings such as schools and workplaces and things like that to really look at a short-term intervention. You have social workers. Social workers also have very good background in mental health and qualified psychosocial healthcare professionals. And you also have occupational therapists who help people performing in various environments, even people who have got a mental disorder. So those are the different kinds of professionals that can exist within the psychotherapy approach to treating abnormal behaviors. And so it's just a case of being aware who those are, and you can find more information on those in your book as well as online. Some of you might go into the direction of becoming psychologists, other of you might go on to being counselors and things like that. So that's where that leads. Okay, so let's just touch on the therapies now. So the first therapy we look at is a broad category. It's called insight therapies. And so that is about talk. It's about verbal interaction. Okay, so that's where you have the picture in your head of somebody on a couch and somebody on a chair listening. That's how we sort of remember what insight therapies are. So it's intended to enhance clients' self-knowledge. And by understanding yourself, it promotes healthful changes both in personality and in behavior. So we think back to Freud, who we've learned about, and we learned that he was the founder of the psychoanalytic movement over 100 years ago. So the concept of talk therapy has been around for a long, long time. So with his concept of psychoanalysis, which we know about, his emphasis was on recovering those things that happen in your unconscious. Okay, so recovery of unconscious conflicts, motives, and defenses. And he used those processes that we speak about, such as free association, and that should say transference, not transurgence. So when we look at Freud, we go back and we saw this when we studied development, when we study personality, is looking back about what causes anxiety. So his treatment was mainly around anxiety disorders, and he called them neuroses. Okay, so it's a disorder that's mainly dominated by anxiety, and he called them neuroses. And it was really sitting in our unconscious. It was conflicts left over from early childhood. And it's the battle that we learned about between the id, the ego, and the superego, where the id is very instinctive, the ego is the reality check, and the superego is the morality. And it's a conflict between those three elements that actually cause anxiety. And that's what he was working with his process of psychoanalysis. So therefore, his role and the role of people who continue in this particular way of treating people is to probe the unconscious through talk, and through talking and through things like free association and the interpretation of dreams. Once those things come to the surface, they can then start to be resolved. So it's the conflict that happens between the id, the ego, and the superego that causes anxiety, and then people have a reliance on defense mechanisms to help them cope with that anxiety. So defense mechanisms are things like repressing those particular thoughts so that they try not to come into your consciousness, regression, denial, rationalizing what's happened to us. Those are all defense mechanisms that sort of help us or prevent us from feeling too anxious. So Freud used talk therapy to get to the unconscious, to probe the causes of the anxiety. So he theorized that people depend on defense mechanisms to avoid confronting conflicts between the id, ego, and superego. But he asserted that defenses tend to only be partially successful, leaving neurotic individuals troubled by anxiety and guilt. So that insight was to probe into the unconscious to try and come to a conclusion as to what was causing that anxiety, and then to overcome through treatment. So there's the image that we know. We have unconscious and our preconscious and our consciousness, he probed the unconscious. So his technique in psychoanalysis was free association, was a technique he used, where clients could spontaneously express their thoughts and feelings exactly as they occur, with little censorship as possible. So anything that comes into your mind, you talk about it, you say it, you encourage a space where people are able to do that. And the analyst studies those free associations in order to gauge what's happening in that client's unconscious that's causing the anxiety. And he also used the process of in his therapy of dream analysis, where clients were trained to remember their dreams, which they then describe in therapy. And the therapist's role is then to analyze the dreams and to try and interpret their meaning in order to provide guidance. So the processes that are used in psychoanalysis is firstly interpretation. The therapist's role really is to be able to explain the inner significance of what is coming to the client's fore in terms of dreams, in terms of free association. So be able to explain what is significant in their thoughts, their memories, and their feelings and their behavior, and offer interpretations that are just out of the client's reach. The resistance process is that our actual psychological apparatus keeps things out of our awareness. And as our unconscious defenses sort of break down, people don't want to face up to those painful issues. So it's about being resistant to training, to therapy. A client might not always come willingly. They might be late for an appointment. They could be hostile, that there is a resistance. Once these unconscious thoughts come to the surface, patients are resistant to actually coping with them and dealing with them. Transference is when clients unconsciously start relating to their therapist in ways that mimic critical relationships in their lives. So that can often allow for the reenactment of repressed feelings. So the processes of interpretation, resistance, and transference, as Freud's original ideas within psychoanalysis, are still used today when treating patients with mental disorders using this kind of insight approach to therapy. So psychoanalysis, like I said, is psychodynamic therapies are still around, which still use interpretation, resistance, and transference. So very much when we look at that process in a modern day, 100 years after Freud, some of the central features that happen is we see there's very much a focus on the emotional experience of the client. There's exploration of efforts to avoid distressing thoughts and feelings. They try to, as a therapist, you try to identify any recurring patterns in life experiences. There's discussion around past experiences, an analysis of interpersonal relationships, very much a focus on the client and the therapist. So that relationship is very important, and as well as exploration of dreams and any kind of vivid fantasy life that might occur. So those features that Freud developed still come to the fore today in people who approach mental treatment using insight therapies. So another form of insight therapy comes from the humanistic perspective, okay? And this is from Carl Rogers, and he developed, now moving on, it's more a client-centered therapy. So it's very much putting the client, who is a person with feelings and emotions, at the center of the therapy. It's treating that person as a human who has feelings and emotions and is central to the process of change. So it again is a form of insight therapy. It's talk therapy, but it emphasizes a supportive emotional climate for clients who play a major role in determining the pace and direction of their therapy. So it's very much client driven. It's about listening to what the client is saying, listening actively, and responding to that. So client-centered therapists help clients to realize that they don't have to worry constantly about pleasing others and winning acceptance, and they encourage the clients to respect their own feelings and values. They help people restructure their self-concept to correspond better to reality. Okay, so that is how client-centered therapy puts the client at the center of the relationship. It's been led by the client. They are the ones who come to the awareness themselves through engaging with the therapist in this process. And they work on the assumption, or Carl Rogers' theory worked on the assumption, that any kind of personal distress is a result of an inconsistency between how we see ourselves and what is actually happening in reality. And it's the incongruence between those two things that causes anxiety and distress, and that's part of the therapeutic treatment, is trying to resolve that incongruence. So Rogers' theory, talking about incongruence, makes people feel threatened by realistic feedback about themselves. So you have an opinion of yourself, how you see yourself, and people hear feedback about themselves, and it leads to anxiety. And the anxiety that they get often results in defensive behavior intended to protect your self-concept that you have about yourself. So hence, client-centered therapists try to help clients restructure their self-concept so that it corresponds better to the reality that they find themselves in. So there's an incongruence between how you perceive yourself and how you see yourself being the ideal person. And the aim is that those two things have to have more congruence. They have to overlap. There has to be some better way to understand yourself so that you can relate to how you should be experiencing your personal circumstances. And very much about helping clients realize that they don't need to gain acceptance from pleasing others. And it encourages the clients to respect their own feelings and to restructure their self-concept to correspond with reality. So it's very much, it's a nurturing relationship about helping the client foster self-acceptance in order to be able to have personal growth. Okay, that is Carl Rogers' approach to insight therapy. So in this process, somebody believes that affection from others is conditional. Okay, so what they then do is they tend to distort themselves so that they feel worthy of affection. And that's where you get this incongruent self-concept, which creates recurring anxiety, which then creates defensive and protective behaviors, which then exacerbates the inaccurate picture of a self-concept. So it's very much a relationship where the negative parts feed into each other all the time, and it's about helping the client break that cycle so that they can actually change how they see themselves and gain personal growth. So he basically said there's three main elements to creating an atmosphere that will create success in a therapy session. And it's very important because this is where the humanistic element comes into this approach to treatment. It's about genuineness. So the therapist has to be completely honest and spontaneous with the client. There has to be unconditional positive regard. So that's complete non-judgment and acceptance of that person for who they are. So no judgment at all, as well as empathy. So understanding the client's point of view are those key parts to the humanist perspective of treating people with mental disorders. So the client and the therapist, they work together as equals, and often the therapist acts like a mirror, sort of reflecting back to the client what the client is saying, and really only asking for clarification to make people more comfortable. So it's what is being said by the client, listening to it, encouraging them to talk, by purely just asking for clarification in certain ways, so that people become more comfortable with who they genuinely are. And by do that, they manage to achieve some kind of reconstruction of the client's personality. So that is how the therapeutic approach works. And okay, moving on within insight therapies. So there's a way of doing group therapy. That's where there's a group of people who come together to discuss with a particular therapist or possibly a counselor. So it's a simultaneous treatment of several clients in a group, where group members actually help each other in their treatment process. So you see, when you see often you'll see something like a movie, and there's a group of people receiving treatment at the same time. They generally help each other. So the role of the therapist in that group is to really screen the potential participants, facilitate the therapeutic process, and prevent potentially harmful interactions. So it has its own kind of strengths. Not everybody can go into group therapy. So, it is different. It can be less costly than individual therapy, and it has its own kind of strengths. You also hear about couples and family therapy, where that's mainly focused on relationships between couples and between family members. And there's many approaches to how you approach this, but all seek to understand entrenched patterns of interactions that cause distress. So between a husband and a wife, how entrenched of those patterns of interaction become, they're causing distress. It's to try and unpack those. It's dealing with families as systems, as units, where the behavior or the distress in the system needs to be corrected by working with the different family members. But it also helps enhance communication, tolerance, flexibility, as well as problem solving in those relationships. And positive psychology is a relatively new movement, and that really focuses on people's health and their own resilience. We did health, stress, and coping, where we touched on the movement of positive psychology. So it's focusing on everything positive in people. It's focusing on our strengths, our ability to be resilient. It's focusing on our positive emotions. So it's called well-being therapy, or also positive psychology. So those are also other forms of insight therapies that we can find. So generally, when we look at the effectiveness of insight therapies, overall, insight therapy is superior to no treatment. Okay, so if it's not saying it's the most effective treatment, and there's different kinds of therapies, and obviously all the clients are different, but it's definitely superior to having no treatment. And it's shown that the effects of an insight therapy treatment are reasonably lasting. Okay, so they're reasonably durable, and it shows a similar efficacy or success similar to drug therapies. Most of the improvement starts in the early stages of treatment. So there's often a rapid period of improvement, and then that improvement tapers off. So any further gains over time diminish. So it's very significant in the first period, but its effectiveness does taper off after time. So each approach has got a different method, but similar benefits are achieved. Common factors that account for improvement. So why is it successful? What is the commonality amongst these different approaches to insight therapy is the actual therapeutic alliance that you have with the person who's helping you. The provision of emotional support and empathy is a commonality across the approaches. Promoting growth of hope and positive experiences is a commonality across the treatment approaches. A provision of the rationale of clients' problems. A commonality is a way of reducing problems, as well as an opportunity to confront problems and gain new insights. So no matter how many types of insight therapy there are, across all of them, there are some common elements, and you can see that across the different kinds of insight therapies we've just discussed. Are you guys okay with insight therapies and understanding the process? Thanks, Pivan. Okay, so the second type of therapy that we look at is behavior therapy. And when we think about behavior, we have our picture of the Skinner box. We also have in our head Pavlov's dog, because behavior is telling us that it's learned. So behavior therapies involve the application of learning principles to direct efforts to change somebody with a maladaptive behavior. Okay, so it's a focus on let's retrain somebody. Let's look at how we can change a behavior. The thing of personal insight, it's not necessary to produce change. It rather looks at the symptoms of the problem and try to change the behavior. So it focuses on two very core assumptions. It's assumed that behavior is a product of learning. No matter how self-defeating or pathological a client's behavior might be, the behaviorist believes that it's the result of past learning and conditioning. Second, it's assumed that if something is learned, it can be unlearned. So that's how the behavior therapy works. Okay, so it's a product of learning, and because it's been learned, it can therefore be unlearned. So it's about attempting to change clients' behavior by applying those principles we learned about the principles of classical conditioning and operant conditioning, or even observational learning, to somebody in order to change their behavior. Come on, slide. Okay, so let's look at certain types of behavior therapies. So with insight, we had the different kinds of therapies. Now with behavior, a similar thing. There are different kinds of therapies within behavior therapy, often used to treat different things. So the first one we look at is called systematic desensitization and exposure therapies. So if you've got a phobia, if somebody is exhibiting some kind of phobic anxiety, a fear of something, it's that fear is treated through what they call counter conditioning. So it's saying a phobia is a learned response to a situation through classical conditioning, for example. Therefore, we have to learn the reverse. We have to go through a process of counter conditioning. So it's systematic desensitization, and you might have heard about that process. It's about somebody who's got a fear of spiders being continually presented with a spider until it gets to a point where they are no longer having a fear of spiders. It's sort of counteracting that learned anxiety. So it works on the process that most anxiety responses are acquired through classical conditioning, where we have that harmless stimulus been paired with a fear-arousing event so that it becomes a conditioned stimulus inducing anxiety. So the goal is to weaken that association so that it doesn't cause that anxiety. So an example might be, in the recent rain, my car aquaplaned and skidded off the road. Now when it rains, I'm anxious about driving. So the way to counter condition that would be for me now to regain my confidence in driving when it's not raining, driving when it's starting to rain, driving when it's raining hard, so that I can counter condition that fear that I have of driving in the rain. So when we deal with somebody around systematic desensitization, there's sort of 4 steps that need to be followed. Firstly, the therapist helps the patient relax, because it's really important when someone goes into that situation, they are relaxed. A hierarchy of the patient's fears is constructed. The hierarchy ranges from imagined scenes which arouse mild anxiety to scenes that evoke intense fear. And then the desensitization begins and the patient relaxes. They start to imagine fear-arousing scenes, and starting with those that are only mildly anxiety-provoking, and the desensitization proceeds through intensity fear-arousing scenes. So you work through those scenes starting from a mild fear, you overcome that, you move on up the hierarchy until you get to that situation that would have been the extreme anxiety-arousing event. The therapist encourages the patient to confront their fears, beginning with the milder ones in real life. Okay, so that's how we sort of counter condition those phobias we experience. And exposure therapy is where basically we put somebody in a direct line of sight of that anxiety arousing situation, but in controlled sessions. Okay, so you're actually exposing them consistently to that anxiety arousing event, but in a controlled situation that can be monitored by the person who's providing the therapy. That is a type of behavioral therapy to change abnormal behaviors. We also spoke about a bit like modeling, is that people have social challenges, interpersonal difficulties, and psychological problems often grow out of those interpersonal difficulties. Due to social skills, inadequate social skills, people have social anxiety. So we acquire our social skills through learning, through modeling. And so social anxiety or social ineptitude can contribute to worsening anxiety and the feelings of inferiority. So when we're dealing with people who've got those social anxiety issues, we basically look at a therapy that emphasizes modeling. So you can watch someone who's socially skilled. In order to reduce your own social anxiety, you learn how to react in a certain social situation. You can do role playing to help people gain more confidence in their social skills, and then gradually changes in behavior occur, and then they can get into more complicated situations. So it's about shaping someone's behavior so that they can get into those situations that would have caused social anxiety, but now they are more confident. Their behavior has been shaped through delivering naturally reinforcing consequences. So that is how social skills training happens within behavioral therapy. Another type of behavioral therapy treatment is called cognitive behavioral treatment. So cognition is how we think, and our cognitive factors, how we think, plays a key role in developing anxiety and mood disorders. So cognitive behavioral therapy, if you look at the words, it's a combination of verbal interventions as well as behavioral modification techniques. So the person who worked extensively in the CBT, cognitive behavioral therapy space, is Beck, and he put forward his cognitive therapy, which is based on the assertion that people who suffer from depression have got a negative way of thinking, with the goal of therapy trying to be to change negative thoughts and maladaptive beliefs. So it's very much that the person's thoughts are impaired. They've got a negative way of seeing themselves. They've got a negative way of viewing the world. And it's those negative thoughts that cause depression. And if you can stop somebody thinking in such a negative way, then their behavior would change, their life would improve. So it's around detecting negative thoughts, testing these thoughts to see how unrealistic they are, because often negative thoughts are completely unrealistic. Use modeling, systematic monitoring of own behaviors, as well as behavioral reversal. And if you change one thing, you change all. So CBT in Beck's theory is made up of our thoughts, our behaviors, and emotions. And all three of those work together to cause a problem. And if you can change one component of that, then the person will change overall. So if someone's got negative thoughts, they have negative emotions, they have negative behaviors, if you reduce the negative thoughts, the emotions and behaviors will change. If you correct a behavior, the emotions and the thoughts will be changed. So it's a little bit like a negative triad. People have negative views about the world that impinges on how we see ourselves, and it gives us negative views about the future. You've got to break that. You've got to break that cycle and encourage people to see themselves in a more positive way. It's how they think about themselves. So when we look at the difference now between insight, which we've spoken about, and behavioral, just to sort of consolidate those differences, in insight therapy, clients get insight or awareness into reasons for their negative feelings or destructive thoughts and attitudes. Behavior therapy helps clients eliminate destructive behaviors that cause negative feelings. Okay, and they instead cultivate healthy behaviors that lead to happiness and satisfaction. Insight therapy is a non-directive type of therapy where the client does most of the talking. Behavior therapy is far more directed. So the therapist and the client have more of a reciprocal relationship where the therapist poses questions and offers more guidance than insight therapy. So the therapist aims to change unhealthy, harmful, or negative behaviors. In insight therapies, the therapist wants to get to the root of the problem. In behavioral therapies, the therapist does not look at what the cause of the behavior is, but rather just wants to change the behavior that is causing the problem. And in insight therapies, we treat pathological symptoms as a sign of the underlying problem, whereas in behavior therapy, we regard those symptoms as the problem. So that just helps you differentiate between the two. So like we looked at insight therapies, we say how effective is behavioral therapy. So again, there is favorable evidence of the effectiveness of the most widely used behavioral interventions, but just don't make global assumptions because it's very wide ranging and they're used for different purposes. But generally, that type of treatment has been found to be effective. Okay. So the final kind of treatment we'll look at is psychopharmacology, which is the treatment of mental disorders with medication. So it's a physiological intervention aimed basically at reducing symptoms. It's using drug therapy or electroconvulsive shock therapy to really reduce the symptoms. And the assumption that it works upon is that psychological disorders, in part, are caused by chemical imbalances or biological malfunctions. So it's nothing to do with what has happened in the past. It's nothing to do with learned behavior. It's basically a chemical or a biological malfunction. And having been diagnosed as such, it is treated with psychopharmacology. So it focused very much on the biological complexity of psychiatric disorders. So this now comes to the point where we're dealing more with what a psychiatrist would deal with than a psychologist. So we have medication. We learned about anxiety. So now when somebody has anxiety and it needs to be treated with a medicine through a psychiatrist, you'd use anti-anxiety medication. So basically those are your benzodiazepines, which are tranquilizers. And the role of the tranquilizer is to sort of decrease the symptoms of anxiety, make somebody more relaxed, make somebody sleep better, but that's what it does. It reduces the anxiety. So how does it do that? And it works through GABA, which is the most common neurotransmitter we have in our central nervous system. And basically GABA is inhibitory in nature, and it reduces the excitability of neurons, specifically those involved with anxiety and arousal, GABA producing calming effects on the brain. So you want to reinforce what GABA is doing to keep you calm. Some benzodiazepines or tranquilizers impact on your body for longer than others. So they have what it's called a half-life, and that really tells you how long that kind of drug will last in your system. So you get some that are short-acting, have a shorter half-life. So basically it's processed through your body. It gives you a relief from that anxiety, and you are able to cope better. Your anxiety reduces and you move on. So it's a short-acting drug, but it does have a high risk of withdrawal symptoms because your body has less time to adapt to it working basically without the drug once you stop taking it. And then you have longer acting benzodiazepines. That means the drugs are processed by your body more slowly, and they take a lot longer to leave your body. So if you take those kinds of tranquilizers, you get that hangover feeling, but you're less likely to have withdrawal problems. And this is where the role of the psychiatrist comes in, is having an understanding of the impact of these different treatments on your physical and your mental well-being, that they can gauge the doses. So often your dosage will change over a period of time depending on what kind of reaction you're having to these particular medications. Antipsychotics are really used to deal with psychotic disorders such as schizophrenia. Okay, so basically you have two kinds of antipsychotic drugs. The first is the first generation, which are your older or typical antipsychotics, and then we have what they call the newer generation or atypical antipsychotics, but they both work differently for different people, and they also have different side effects. So our first generation antipsychotics can actually have side effects that cause movement disorders such as tremors and muscle rigidity, and they also can make you drowsy, whereas your second generation, the newer ones, cause less severe movement disorders, but also have side effects like weight gain and changes to our blood sugar levels. So it's important to understand that the medication might help alleviate the symptoms, but there are significant side effects, especially when you're dealing with medication at the level of antipsychotics. Okay, so the side effects that are experienced depend on the dosage and responsiveness. About 70% of cases, once they go onto a treatment regime, begin to respond after about 3 weeks with a general improvement over several months. And often you find with antipsychotic medication is that your patient begins to improve. Therefore, there's a belief that they are better. Therefore, they stop taking the medication. But it's really important that if somebody is diagnosed and is prescribed antipsychotics, that they take them as required in order to reduce the symptoms of their diagnosis, and it could be over a lifetime. Antidepressants are very common. So the role of an antidepressant is to improve a depressed mood, and that works around serotonin. So serotonin in our body affects our well-being. It improves our mood, our quality of sleep, our energy levels, even our digestive system. So basically what an antidepressant does, it stops the serotonin that is produced being taken up again into our neurons. Okay, it inhibits that reuptake so that we have more serotonin remaining in our body, remaining in our nervous system, so that it blocks it from sort of re-entering, and the level of serotonin remains high, and then the brain can carry out its mood lifting function. So it's used to treat moderate and mild depression. Okay, again, it doesn't happen automatically. It takes a while, usually 2 to 3 weeks, for the role of an antidepressant to start to work and people start to feel better. But they often say that there can be increased suicidal tendencies in younger patients, especially in the early stages of treatment. There can be what's called a serotonin-induced anxiety. So again, you can see the side effects that happen with taking these kinds of medication if they aren't properly administered and people guided accordingly. Mood stabilizers are another type of treatment which is used to treat psychiatric disorders such as bipolar. And those are there basically to help control and reduce mood swings. So people with both depressive and manic or psychotic problems often come to rely on this kind of medication. It's often prescribed to prevent problems after the first episode or crisis. So if somebody presents with this kind of disorder, it's usually prescribed straight away, really to prevent it from happening again. So generally, again, this is where long-term use of this medication is advised. It can lead to lithium poisoning because it can create too much lithium in the blood, which can be called lithium toxicity. And there are other alternatives that have been developed, again, that have fewer side effects. So it's important that people in the field keep up to date with the development of new technologies in the drug field for actually prescribing medication. And the final kind of pharmacological intervention is the electroconvulsive therapy. So that's basically where on the brain, there are electrodes put on the brain and people receive an electric shock, which induces a seizure with convulsions. Okay, and it basically restarts your brain. It kickstarts some of the wiring in your brain to help overcome some of the mental problems. So the patient is basically anesthetized, is made to relax. The electrodes are put onto the brain, especially in the temporal regions, and a current is applied, very quick current, on one or both sides, which increases the levels of nerve activity in the brain. It's a very controversial approach, and it used to be used more frequently in the early 20th century, early to middle 20th century, but basically it's not used as much now because we have a better regime of drug treatment. But it is, however, sometimes used still in the case of severe and resistant depression. Overall, there's enough favorable evidence to justify conservative use in treating patients who are suffering from severe mood disorders who aren't responding to medication. So medication is the first choice, and only under certain conditions would the process of electroconvulsive therapy be used to treat someone with a mental disorder. Okay, I'm just going to stop the recording now because that's the end of the slide.